What is the biggest lie that patients tell you?
Their age.
I had a patient who was really asking me if she will get some characteristics of a salmon after the treatment.
Out there.
And I first laughed because I thought it's a joke. Everyone, and welcome to the Koru Aesthetic Dialogue. I'm Dr. Sophie, and I'm very happy to welcome you as a host to today's podcast that I will be sharing with Dr. Walter. We will be speaking about modern aesthetic medicine, the regional trends between Europe and Southeast Asia, and how we can treat polynucleotides in a safe and effective way, especially for targeted areas that our patients always seek to have a natural and beautiful rejuvenating glow. Let's welcome Dr. Walter to the show of today's podcast. I'm very happy to have him here on my side because he is a very truthful and precise professional in this field of aesthetic medicine. Hello, Dr. Walter. Thank you for joining me here today. How are you?
Thank you for that very warm introduction. I'm doing well. I'm so excited to start this podcast. This is my first podcast, so I'm happy to do it with you. Hello, everyone. I'm Dr. Walter Laurel from the Philippines. So I was born and raised in the Philippines. I finished my medical school over there. And then after that, I went to New York for my residency in pediatrics. And then I worked in California after that. So I've been a pediatrician for almost 10 years. But what changed? So when our kids were born in 2020, in the midst of the pandemic, I told my partner, if we're moving back to the Philippines, I want to pursue something that I've always wanted to pursue for the longest time, which is making people happy, doing procedures with my hands, and no more night calls.
That's great.
So that's why I went into aesthetic medicine, and I've been doing this for the past 5 years. And right now, I'm the medical director of Ilum Medical, and also the KOL, one of the KOLs for Koru Pharma.
Amazing. So and that's how we met, right?
Yes, and that's how we met, and it's been an amazing journey ever since.
I can imagine. So would you share with me, please, like how did your pre-specialty shape your approach to aesthetics? Like, do you think you practice it in a different way than other doctors who directly after finishing medical school started with aesthetic practitioner?
You know what? Actually, residency helped me a lot with how I deal with my clinical training or clinical practice today, because whatever I do, it has to be evidence-based, as what we were taught in residency. So
I can imagine, like in pediatrics, you have a lot of responsibility.
Exactly.
It is not the kind of specialty where you try and experiment.
Yes, that's true. And I will only give treatments if I've researched on it, if there's evidence on using it, and if it works and if it's safe for the patient.
Very personal question.
Yes.
Do you have sometimes the feeling that what we do in aesthetics gives you less purpose and less meaning than, like, let's say, saving lives of a child?
Well, I think we're saving one face at a time, right?
That's true.
we're doing the world. We're serving our purpose. We're making people happy about themselves, especially after they come out of the clinic. They feel good about themselves, and that's the best feeling that I've. And that's the feeling I want to see every time I see my patients.
I completely agree. I think also aesthetics is much more than just delivering a service to people, because sometimes aesthetics seems like the patient comes to the clinic and asks for this or that treatment.
They think it's just skin deep, but it's more than skin deep.
It's much more, exactly. I think it's all about psychology, about the moment of the person's life that they're in, and why do they seek for these treatments. Like, they really want something more ahead than just the Botox treatment probably, or just the filler treatment. They really look for an enhancement. Probably they go through some identity crisis in their lives, and getting an aesthetic treatment done is something really important and personal for them. So we are like the guidance for them to get them through that.
I know what you're saying, because the confidence that you see in our patients, it really they feel good about themselves, and when they walk out, it's like they can face the new world in a whole new face.
Absolutely. I truly agree. Thank you for sharing your story. That's very interesting. I can relate to that as I was trained before in Germany as a neurosurgeon.
Mm-hmm.
So that always gave me also a more medical approach to things. So I believe that a part of aesthetics patients also deserve health and prevention in medicine because that might be the real beauty, how they can shine
Right.
if they're well from the inside. And yeah, also neurosurgery. I guess pediatrics this is the same. Like we
Mm-hmm.
saw a lot of suffering in
Right.
patients, a
Mm-hmm.
lot of sickness, like actual
Mm-hmm.
medical indications and
That's
necessities
true.
for that.
Yeah.
I always have the feeling that aesthetics are not really necessary for patients, like life or death.
Mm-hmm.
But anyway, for me, it gave it some kind of ease. And to be able to work on the bright side of medicine is something very beautiful. Dr. Walter, would you share with me how your daily life looks like? Everyone is super curious on how does your life in the Philippines look like? How do you
Oh,
treat patients? What
okay.
about your clinic? What is your star treatment right now?
Okay. Well, I have a small clinic practice in the Philippines, and I want to keep it that way because I want to have a work-life balance with my kids. Now I enjoy bringing them to taekwondo practice or ballet practice. That's why I only see my patients in the afternoon, only like 3 or 4 a day. And I wanna I take time with them when I see a patient. It might take me an hour or two, even if it's just for a simple treatment.
I
B-
love this. I
Yes.
love this. We actually have the same
Yes, yes.
purpose then in how we want to treat our
Mm-hmm.
patients. I see this quite often in some low cost clinics where they treat more patients, like a higher volume,
Mm-hmm.
and they really aim for probably lower quality but higher
Yeah.
volume. And I really love to have an approach where I really can take time
Mm-hmm.
for my patients. And like you said, it's a simple treatment. Sometimes they just want to get an information or
Uh-huh.
retouch. I anyway take a full hour for them.
Yes, and these are my friends and the friends of my friends and the friends of my friends. So it's more like a small community. So I
It's
want
so
to
true.
make sure that I give them the extra care, the extra touch that they need.
That's so
That's why.
nice.
So for me, I go over quality rather than quantity anytime.
I agree. I
Mm-hmm.
agree. For me, it's the same. I have sometimes the feeling that I spend all day drinking coffee with my friends
Mm-hmm.
and making them more beautiful.
Yeah.
It doesn't feel like work.
Exactly.
That's
That's
great.
what I appreciate about aesthetics, about the work-life balance, and no more night calls.
No more night calls. We got that. You didn't like those. Great. So, what would you say? What is your star treatment right now? What is your procedure that you most like to do?
Hmm. Good question. I think everyone now wants to have polynucleotides. I think it's all about salmon sperm, salmon DNA is the craze. So my patients want to see me regularly. They go to me like every 3 or 4 months just to have that glow up.
Nice.
And once they start experiencing that glow up, they want to maintain it. And they want to make sure that they're ready for any party or if they go on traveling. So that's one of my star treatments right now,
That's nice.
polynucleotides.
To get the glow,
Mm-hmm. That extra glow.
I'll come
Glow up
visit
with
you.
salmon sperm.
I'll come visit you for that extra glow in the
Of
Philippines,
course, you
definitely.
can come see me anytime.
Thank you so much. And your transition to be a national and international KOL and educator, what does that mean for you?
Wow. Well, I think the reception is pretty warm, and I think people are drawn and are curious. And I just love what I'm doing. I love educating and teaching other doctors on how to do certain procedures. And it's more like a 360 now. Before I was a student, now I'm teaching them on how to do things.
That's amazing. Thank you for sharing. Yeah, and I believe really that it's not really so much about the time and the years that you
Mm-hmm.
accomplished in a specialty. It's more like about the experience that you have,
Mm-hmm.
the day by day clinical expertise that you practice with your
Mm-hmm.
patients, and this kind of nearness and warmness that you
Mm-hmm.
transmit to your patients. And this is something that, as a colleague, I can definitely capture
Right.
the same, and that what transmits finally the trust of this is a colleague that I would listen to in terms of asking for some information about the newest
Exactly.
treatments.
And if it's something that you enjoy doing, everything comes flowing naturally.
It comes
And
natural.
it doesn't seem like a job.
That's
It's
true.
something that you wake up each day that you're excited to do.
That's true.
And I can see that, well, it's almost, it's like finding your purpose, right? And your passion as well.
I can definitely feel that. And I think that makes a difference in terms of the comparison with other big names in the market. Sometimes they can't transmit this energy and this feeling. So I can see that you definitely have that full package. So I'm not wondering that you're a big star on the KOL.
That's why we're both here, Dr. Sophie.
Yes. Okay. Great. Let's move on to the next chapter where I would like to speak a little bit more about the beauty standards in our different regions, because we know that this is varying a lot. And what a patient might ask in Europe is very different from what they might ask in the Philippines. So would you share your insights on that, please?
Well, since the Philippines was colonized by Spain for like 300 years, so our standards of beauty are more Western, I think.
Really?
So people like to have that fair and that pinkish white kind of skin, but also not just white, but also like with a healthy glow. So with a pinkish glow.
Interesting.
Yes.
So I think maybe the mentalities of both countries shifted, because in Spain people love to take a lot of sun and be
I think
tanned.
you have to want to go to the beach and just tan yourselves the whole day.
Exactly. They don't
Which
really
is
want to
kinda
have the
opposite
whitish
here
skin.
in the Philippines. Everyone would put in a lot of sunblock. They would go out with the umbrellas, just to get out of the sun.
Wow. I think people in Europe should be more educated on sun protection. They should take a good example from the
Cultural
Philippines.
differences.
Interesting. So would you say also that Philippine patients would seek more for natural results, or would they ask for more dramatic changes?
Oh, with Filipinos, we want the more natural, the better. We don't want to look fake or that puffy or overdone look. So people tend to gravitate towards natural results.
So do you get this question from your patients, like while you're in the treatment, injecting the needle, and they ask you just a little bit, Dr. Walter?
Yes, just a little bit. I don't want to look too done, and I don't want to go out and my friends will tell me, okay, I think you had something done. So what they want is something subtle and natural.
Exactly. I think that's the same mentality as we can see in Europe. People want to seek for very, very natural and subtle results. I think that also regenerative medicine is something that is starting to be very popular. They still don't have a lot of knowledge on this field. So I think education is very important to teach them what is all about these regenerative treatments, like polynucleotides, like exosomes. But they really love the concept of having something natural, like natural healing benefits and anti-inflammation and something tox-free. What do you think in Philippines?
In the Philippines, I think we're still pretty new to this injectable trend about the whole biostimulators and skin boosters. I think we've been only doing it for the past 2 or 3 years compared to our neighbors in Japan or in Korea, where they've been doing this for some time now. But I think Filipinos are warming up to the idea of having something injected into your face, and then you would look probably terrible for like a day or two, and then you will start seeing results in the next few days. So it's still something new, but I think the Filipinos are getting warmed up to this idea.
Amazing. Thank you for sharing. And would you say that what you just mentioned, your neighbors, Japan and Korea, they have a lot of history in aesthetics in general. I mean, they go million years beyond and treating aesthetics in a very different way than other countries, but they are always the trend for other countries. I have seen that in Europe, everything that comes from Korea is very popular, but we also look at this with our suspicious eyes, like, is it really what is promised? And is it really safe? And do we really want to seek for this perfection of skin, of glass skin, like we can see in some Southeast Asian countries? What would you say? How do people think in the Philippines about Korean aesthetics?
Well, since K-pop is quite popular in the Philippines, so a lot of people look up to that Korean glass skin. And some of my patients will also tell me, I want also to have that Korean glass skin look, like, that very dewy, that like I woke up like this without putting anything on my face kind of look.
A huge lie in aesthetics.
Yes.
No one looks like this perfect in the morning when they woke up.
But now I think...
Except you, maybe, Dr.
Yeah.
Walter.
And you too, Doc Sophie.
Interesting. So I think in Europe, sometimes this suspicious mindset of patients is something that is like making them being more afraid of those treatments because they don't want to look perfect. They really like to age gracefully, but just maybe with some small retouches to
Uh-huh.
look more beautiful or more fresh or more rested, but they don't really seek for this perfection. So K-pop is maybe something that European patients would rather reject
Okay.
than seek for it.
Oh well, yeah. It will be nice to still have that K-pop aesthetic, but aging gracefully. I think we can
A good
probably grow
balance.
into that um, probably meet in the middles kind of way in that aspect.
That's great. The balance is
The
always the
balance is
right.
always important.
Nice. Thank you for sharing on that. So, starting with the next topic, a
Okay.
very interesting one because I know
Mhm.
that we are both specialists on this field.
Yes.
We just had a great symposium on the
Mhm.
AMWC Southeast Asia.
And you were awesome in that symposium.
Thank you. You was awesome. It was an honor to have you on my
Oh,
side,
thank you.
really.
I enjoyed that experience very much.
Me too, me too. And I really love that we shared
Uh-huh.
the same mentality and approach on how to work with polynucleotides. So, what do you think, Dr. Walter? What are the market trends? Why do polynucleotides really raced and really accomplished the number one treatment in the market?
Okay, because I think since everyone now wants to have that subtle and natural look, I think the trend right now is going to more regenerative aesthetics. So something that will give you like a natural boost of rejuvenation. And I think polynucleotides is one of those products that can deliver. And that's why my patients love it so much. They once they start seeing that glow, they just want to keep on doing it regularly.
That's amazing to hear. I
Mhm.
think it's the same in Europe. In Europe, patients are a little bit more suspicious towards new trends. So it's not
Yes.
like there's something going viral on TikTok or on Instagram. They hear this. They first are a little bit suspicious and want to know more about it before they try it on themselves. But it's the same. Once they have tried it, they really seek for more because it really
Mm.
delivers results.
I'm curious. So how do your patients react when they find out, oh, you're injecting salmon sperm into my face?
You have to be very careful on how you approach and how do you educate patients on this. Some really actually come and they say,
Mhm.
is it true that it's salmon sperm?
Mhm.
And I have to tell them, yeah, it kind of is, but like anything that we do in medicine is coming from nature, right? Any
Mhm.
kind of medication that people developed in the pharma industry, everything has a background coming
Mhm.
from plants or coming from nature, even from animals. So here we just use the same concept of something what was long time working before. And of course, I explained them that regenerative medicine is the new rise in
Mhm.
aesthetics because exactly what you said, we can have something biocompatible, something gentle, something very safe,
Exactly.
and something delivering, no?
Mhm.
Something that is longer lasting than any kind of biostimulating or just lifting or just paralyzing, like short lasting effect. So patients really wonder if it's really true, if it's myth or truth. So it's a funny conversation to have them, but you have to be careful how you name it because they could reject something that is animal based, that is not vegan,
Mhm.
that is maybe chemical in some other products than polynucleotides. But patients are very careful on what to put in their face.
Yeah.
And what I would like to add on the topic of polynucleotides and why they're so popular, I think they are a very stable and reliable treatment that really delivers results. As you said, no, there are always new trends and always new products on the market that sometimes are not directly evidence based. But when we see in our daily practice that those products deliver, it's something that we gain trust with this and that we want to keep using it as well.
That's true. And since I've been using polynucleotides, I haven't had any serious or adverse reactions in any of my patients. Is it also true in your case?
Yeah, absolutely. I didn't have any problems on that. They are anti-inflammatory, they're biocompatible. So it's something very safe, which is also very important in Europe. You don't want to do experiments on your patients.
Uh-huh.
And I think it's one of the most important characteristics on how I choose the product that I use for my patients. What would you say Europe versus Asia and versus Philippines in a
Mhm.
specific? What do patients seek for? Do they go for trends? Do they read something on the internet or see in the social media and then they come to you and they ask for this? Or do they rather ask for the results or
Mhm.
for the solution?
Okay. I think now with the advent of social media, I think the Korean glass skin hashtag Korean glass skin was pretty much trending for the past year, and my patients are curious. So, what is this new treatment? Okay, what is Korean glass skin? What is the salmon sperm or salmon DNA facial? And what is Kim Kardashian and Jennifer Aniston getting obsessed about? So yeah, so these are pretty much like polynucleotides, and there are popular brands out there of polynucleotides, but I think people are more drawn to to the result. Okay, so as long as they know it's a good source of polynucleotides, they don't care what the brand is,
Hmm.
as long as they get that glowing effect.
And they trust you with this, right?
Yes.
Because you're the professional. What I have
Mm-hmm.
seen so many times is that patients have heard something like a viral trend or something,
Mm-hmm.
but then they don't know actually what it means because it's quite complex to understand this biotechnology behind it and about the production. And I've seen also many other brands that don't really disclose the
Mhm.
origin of the source of the salmon or
Mhm.
of the purification process. So if we have all the knowledge about, we as practitioners, we actually know what we deal with and we
Exactly.
know what we put in our patients' faces, right?
Exactly.
Doc Walter, what do you
Yeah.
think? Do patients ask you for the specific background of a product? Like, how does it work? Do they want to know the details about it, or do they just lay down and say,
Yeah, they just lay down
"Get
and do
go,
me.
make me more
I don't wanna
beautiful"?
hear all those scientific and medical things. Just, they just want to make sure that they will get immediate results after one session.
Hmm.
That's what they're after for. So well, with that, you just have to deliver, and you gotta make sure that after one session they'll start seeing results.
And would you think, or would you say that this mentality has changed over time, or have they always been so demanding?
Well, at least for my clients, they're not really into the finding out how this works medically, or what's the scientific use of this product. They just want the effect.
Interesting. I have a little bit of both, and I
Hmm.
would say that 90% of my patients, they at least appreciate me explaining them the
Really? Okay.
background about the
Uh-huh.
products. They really want to know. They find it rather interesting, and they appreciate the fact that I'm explaining them so much because they
Hmm.
can see that they don't really get this in other places,
Okay.
where it's just like lay down, do the
Hmm.
treatment, and don't really ask
Uh-huh.
questions. So they're happy to hear more about
Okay.
it.
Well, with my patients, I think they're more after what will be the potential side effects, if there will be like any complications, if I will get swollen, bruising after I use this product. So I think that's what more they're after, and also the effects.
Yeah, they really want to be prepared for
Uh-huh.
what they get. Yeah.
Yes,
Yeah.
exactly.
I just have had one patient that was like straight away I was doing my my daily practice of starting to explain a lot and showing things and examples and slides and stuff like this.
Oh, really?
A
Are
little
they
bit
also looking for those
exaggerated.
evidence-based journals and stuff? Yeah.
Sometimes patients want to have more background, and I have
Okay.
to send them information on the treatments that we do and on the evidence behind that. So patients are really curious and very suspicious on the treatments. But I had this one patient who was like looking at me, and she said at one moment, I don't want to know any of this. Just and she was a doctor. She was a medical doctor. Actually, I thought that she would be the kind of
Uh-huh.
patient profile that is asking for more information because she understands that.
Mm-hmm.
I always have to adapt also to the patient that I know that they will understand a little bit the academical speech
Mm-hmm.
about the background and the ones that need to keep it more simple.
Okay. Well, in my experience, I think my patients put so much trust in me. So whatever I say, they will accept it. And their usual line is, okay, do what's best. Whatever you think, doctor.
That's amazing. That's
Mm-hmm.
good to hear.
So
Yeah.
that's why I have to make sure that I choose the right product, and I don't fail in delivering results.
Because the trust that they have
The
towards
trust in they put
you,
in me is so much, and it's so important that I don't break any of those.
that's nice. So do you trust Koru Pharma's products?
Oh yes, that's why I'm speaking for them.
That's why we're here. Yeah. I think this is another very interesting topic
Mhm.
to talk about. Like, why would you present a company rather than the other one?
Oh, okay. Well, with me, before I try anything else, before I say anything, or before I teach anyone about a certain product, I have to test it on myself first. And once I see the results on me, that it's effective and safe, then that's the time I will start treating my patients with that product.
Yeah,
Th-
true.
yeah,
Very
that's
nice.
how
Yeah.
I go in life.
Patient X is always yourself.
Yes.
Yeah.
So I have to experience those effects first and give an honest feedback for my patients, because I don't want them to, I don't want to just go injecting and then I would start seeing this adverse reactions. I would really feel bad if that happens.
True. That's nice that you
Mhm.
keep this mentality of being responsible
Mhm.
and trustworthy for
Yes,
your
my patients
patients.
are always, I keep them a priority, that I don't do any harm on them.
Nice. Yeah. We swore this one
Yeah,
day,
that's
right?
our Hippocratic oath.
That's true. Let's move on to the next topic. I think it's a very important one to discuss between us as we
Mhm.
come from different regions. So,
Yes.
in Europe versus Philippines, what do you think how much social media is affecting your work in a good way or in a bad way?
Well, I think social media has been a big presence, and Filipinos are very much are pretty much on social media. So we do see a lot of things from TikTok, from Instagram, and I must say, I mean, our beauty standards are still changing, but there's still a large influence from Europe and from the Western regions regarding the standard of beauty. That's why our patients usually go for that, like what I mentioned. They want a more like a whitish pinkish glow with their skin, which is more like a European standard of or the usual European face, right?
Yeah, the natural one.
The natural one.
But if I tell them about brightening creams and
Uh-huh.
treatments, they're like,
They
but
they
I
don't
don't want
like
to
it.
lose my tan. Exactly.
Exactly.
Yeah, interesting. I think it might be a little bit different in
Mhm.
Southeast Asia versus Europe in general about marketing.
Mhm.
There are a lot of problems with marketing in Europe because you can't name brands. It's
Mhm.
forbidden to show
Oh yeah.
before and after in some countries. They really want to get away of this like over-promising approach of clinics, like showing this is the best result that you can get, but it's
Mhm.
not always the reality, right? So they don't want to promise things anymore. You're not allowed to name brands specifically.
Mhm.
So you have to be really careful with social media. And
Uh-huh.
I've seen that sometimes patients tend to reject something when they see that the
Yeah.
marketing is overdone because it seems like overselling something
Right.
that doesn't need to be sold if it works.
Yes. Right.
Different, right?
Yeah, that's true. Yes, yeah,
Yeah.
I agree. But you know what? I mean, Korea has been there for the longest time, right? With regards to with emerging beauty trends and treatments. But I think some of the Italy came up with those products first, right? In a couple years back.
Yes, I believe so. Regenerative medicine
Mm-hmm.
is very popular in Italy, and there's a lot of research based on Italian brands in
Mm-hmm.
general. I think they revolutionized at some point the exosome use and polynucleotides use because they have thought that this is rather cell waste and something
Mm-hmm.
that can't be really used for therapeutic applications.
Yeah.
So they're very strong in research in general, and it's an area where we can rely on the evidence based medicine.
Mm. Okay.
Because I think, as you know, and as you also treat integrative medicine,
Yeah.
that's right. You
Mm-hmm.
like the use of peptides
Yes. Yes.
and
Those
supplementation.
drips, peptides, and then also for the hair supplement, and also for the skin. Yeah, like
That's
you, I'm also
amazing.
trying to make it like a holistic approach for my patients.
That's great. I think that's very necessary.
Yes, that's why I take like an hour to just on one patient.
Do they always follow your leads?
Well, most of the time.
Yeah, that's great.
How about you?
Well, I was figuring out that moving from a medical field
Mm-hmm.
where people come more for the health necessity to a field where people come for beauty, I think the aesthetic patients, they are a great target group to treat integrative and holistic medicine because if they are up to pay for a treatment for their beauty,
Mm-hmm.
they're also up to take care of their inner well-being.
Yeah, right. Because you
So
also do like spiritual well-being, right?
that's right. I think it's so important to take care of the mental well-being, the energies, because this is what finally makes us being happy, and
Right.
that happiness will reflect on our beauty.
Okay, Maybe you can teach me some of those later on.
For sure. Definitely. Let me ask you another question,
Sure.
Dr. Walter. I'm
Yes.
curious on how do you manage your social media? Do you have a personal account? Do you have a professional account? Are you very active?
Mm-hmm.
Are you an influencer on social media?
Okay. To be honest, I don't like being on social media that much. My profile is private, but but people can find me there if you have some questions, because my social media is more like a representation of my personal and work life.
That's
Yeah.
nice.
So when you go to my social media, you don't just find my professional life out there, but you can also see my family, my kids, my everyday routine. So I like to keep it a little personal.
I think that is very beautiful because
Mhm.
patients, also colleagues, also friends all over
Mhm.
the world. I mean, that's a way how we connect with each other. And I think it's
Mhm.
a beautiful way on how you share something about your personal life, which makes you much more trustworthy probably than just
Mhm.
showing the before and after pictures.
Right.
Yeah, nice. I have my difficulties to be very active on social media as well.
Mhm.
I think there are some countries that are very strong in
Right.
terms of social media because it's trendy. You follow an influencer doctor and everyone else wants to do the same like this influencer doctor.
Mhm.
I think we have to stay a little bit more authentic
Yeah.
in a world that should not be only marketing and commercial. It
Mhm.
should also still remain a medical specialty, right?
Right. And you know what the thing is, even if I don't put out so too much even if I don't put out a lot of marketing for my clinic, but patients are still going in, and and I'm seeing my fair share. It's like friends referring out friends, and I think word of mouth is still the best marketing.
I also think so. And it attracts rather patients that
Mm-hmm.
will trust you, that will come to you for the long
Mm-hmm.
run rather than the fast result
Right.
patients that want
Exactly.
something quick.
And
And
what they see on their friends probably is the best marketing out there, because when they see their friends, okay, something's going on, you got to tell me your secret. And that's the time they will those friends will bring out their friends, and next thing you know, you already have a full practice.
yeah, absolutely. It happens so fast.
Yes.
I think this is the best compliment that I can get from a patient when they go to their country of origin, because sometimes I
Mm-hmm.
have international patients and then they go back to see their friends, to see their family. And we did like consistent work on
Mm-hmm.
them to look more beautiful, to look more young, and to have all of this regenerative
Yeah.
rejuvenation. And then they come back to their country and all the friends tell them, you look beautiful, you look rested, but it's not visible that you had something done. For me, this is the best compliment.
I know, and that's the best compliment as well. If you get referrals from your clients, then I think you've done something right.
Yes, especially when they bring their moms, right?
Exactly. When they bring their whole family.
That's the best compliment, yeah.
That's true.
Because that's trust.
Right. And then I have this one patient. She told me, "Can I just tell them if someone asks if I had something done, that I'll just tell them, oh, it's just like regular exercise, good diet, and prayers." Well, it's up to you. but
Exactly.
but 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 the thing is, she cannot keep the secret to herself, so she has to tell it to her sisters, to her in-laws, and the next thing I know, now I'm seeing the sisters and the in-laws and all of her families. So it became like a family secret.
That's the best feedback.
Yeah, and that's the best. I think that's the best compliment and the best feedback.
Absolutely. I can see why your patients trust you, Dr. Walter.
Well, thank you.
And I believe that this is a great transition to the next topic where we
Mhm.
want to talk a little bit more about your personal experience with patients, some insightful and exciting, and maybe
Mhm.
also some troubling patient cases that you had. So, would you share with us that that information, like your experience with patients, your
Okay.
most interesting case?
Okay, that's a pretty hard question, but but I can think of some funny cases. Like there's one time, I think a friend and also a client, she came up to me, and after having the polynucleotides done to her face, after having her salmon sperm facial, she said, "Oh my goodness, this is the best glow I've had. I gotta go back to my husband and and get some more sperm." Uh, what? Okay. What is she saying? Oh no. Oh, she meant that she has to go back to her husband and ask for more funds to keep on getting the salmon sperm facials.
That's a funny story. Yeah. They can get the concept a little bit different. on what
So
they
that's
get.
why I can see that they're clearly enjoying this kind of treatment.
Nice, nice. So
How
you
about
have.
you? Do you have any personal stories?
So yeah, I have some funny stories to
Mhm.
tell as well because there's a lot of lack of knowledge, to be honest, in Europe. So I usually first have to explain patients what is the treatment on mesotherapy, on microneedling. So first I have to tell them like how they get this done, and then I tell them what do they get done. And I don't want to scare them off, obviously. So I'm very careful with the terms and terminology like salmon
Yeah.
sperm because I think they would run away.
Well, I do get a few giggles when they hear about that. But anyway, go on.
They're happy about this, not? Yes, that's what I want. So yeah, I had a patient who was really asking me if she will get some characteristics of a salmon after the treatment.
Oh,
As
will
this
she
is
look like a
DNA.
salmon?
Yes,
Okay.
exactly. Like, and she was completely serious about this question, and I first laughed because I thought it's a joke.
Well, well, with that, I kind of, well, when my patients ask that, what will happen? Well, I kind of jokingly tell them, well, you will look like a salmon, like right after the treatment with all those little bumps. Look like a little puffy fish, but a cute one.
You will be able to breathe underwater, probably.
But don't worry, after like 2 or 3 days, those bumps will be gone, and then you will start seeing the results. That's what I tell them.
That's nice, yeah. And actually, as we know, like from the technology behind that, no DNA is really integrated into your genetics, so they can be absolutely safe. But this misception sometimes we can hear.
Right.
Yeah,
That's true.
So, what would you say? How many patients in? Just let me know a number on percentage. How many patients of yours got the polynucleotides?
Maybe at least 100.
Yeah.
Yeah.
Yeah. I would also say so.
Yeah, because I already bought like 100 boxes at least.
Nice.
So I've used all of them up.
That's good. You need to do another purchase. Yeah, same for me. Yeah, I think it's one of my most popular treatments nowadays. So sometimes it's like, okay, what do we do today? Is it Botox? Is it lips? Sometimes it's also very popular, surprisingly, in Germany because they seek for more natural results, but then they want a little bit of lip filler and glow.
Okay.
And then it's all about skin quality. So for me, skin quality is health of skin.
Yes.
It reflects on our inner state of health. So polynucleotides are one of the treatments that is the most demanded. It's like either you get toxins or you get polynucleotides. What do we do today? So it's I would also say like probably 100% of my patients have tried or are in the waiting list to get it done.
Right. And I agree on that. So what's a good measure to see if your skin is healthy? I will tell them if you see that glow.
Yes.
And that glow is really apparent after you try on this polynucleotides, right?
That's right.
Even if you don't use anything on your face, no moisturizers, no makeup, no anything, you would see that, okay, when you look at the mirror, okay, oh, wow, something's glowing.
Absolutely, because I think that the skin health is reflecting the inner health, and you can see when someone is sleeping bad, having a...
Yeah, it shows up on your skin.
It shows up on the skin. Like, have you known that going back to the stem cell lines in a fetus, that actually mesenchymal stem cells are the progenitor cells of anything what comes afterwards. So it's the same family that develops the skin cells, the gut system, and the nervous system. So obviously, I always tell my patients, if there is something wrong with one, it shows in the other. It shows like in the little brother, when you have problems with the gut system, you might show some changes in terms of like inflammation or acne on your skin. Yeah.
Well, with my clients, they just want to look glowing all the time, even if they're like even if they don't have any sleep or stress out. I think this is like their cheat way of just getting that instant glow up.
You want to balance their
Yeah.
bad lifestyle with the treatments to get.
Well, I think that's one of our purpose here, just to help them,
That's true. Yeah.
get going.
True. I believe that this is the fact. And I think that natural skin beauty and skin health is something so important because I think the previous approach in aesthetics was more rather paralyzing with toxins, a lot of lifting, a lot of overfilling. and skin health was not so important.
Right.
So I can see that there's a trend on that patients ask more for beautiful and healthy
Mm-hmm.
skin, because this is for me 50% of the beautification and rejuvenation.
Right. And I also want to add on that once for example, my patients start using the polynucleotides, they notice that they seem to need less and less of toxins.
True,
Yeah.
true.
Yeah. So they would, I think most of them will just come up to me for regular, maintenance sessions, and they would require less and less treatment for the toxins
Yeah, everything
because it works
lasts
well for the
longer.
fine lines and wrinkles.
Absolutely. Yeah, absolutely. I think we had this discussion yesterday
Mm-hmm.
also with more practitioners out there, that polynucleotides not only can be a great asset to use as a post-procedural treatment, like after any kind of device-based medical
Mm-hmm.
treatment or after some kind of abrasion or peelings, that also they can be like a good preparation for
Yeah,
making
it's
other
quite versatile.
treatments
Actually, you
work
can.
better.
Yeah,
Huh?
that's true. You can use it like before you get your laser procedure and or like any energy device, and you can also use it like after your
For recovery.
for recovery because it's also anti-inflammatory.
Yeah.
It will speeds up the wound healing, right? It would speed up the swelling and decrease the inflammation. So it's also it's also a great post-recovery treatment.
True. It works for both, because
Yeah.
we want to really work on the cell function here. So I believe that as we have polynucleotides that really improve the health from within, from the cellular function,
Mm-hmm.
this is a concept that will make everything else work better.
Yeah.
Yeah.
I agree. Amen.
Nice. Mm, Dr. Walter, would you share
Yeah.
some other memorable cases of your clinical practice, of your experience, some cases which was a little bit more troublesome?
Oh yes, because I like using the Crystal Healer PN Plus. As you know, PN this has 2% polynucleotides and 1% of HA, and HA kind of draws a little water retention, right? So because I like using the cannula method, especially if they have sunken under eyes, and it really works great because instead of using like your or the routine HA filler, I can use this like a filler but more natural without the over puffiness look. But anyway, so I put in the PN Plus under her eyes, and it gets swollen for 2 or 3 days, but she panicked. So I told her that's okay. That don't worry. That's part of the process. Just trust the process. But she would go to my house every day just to make sure that I put ice compress or ice packs under her eyes. But I know it's there's a little bit of swelling which will naturally go down for in 2 to 3 days, and after that, when the swelling went down, she was so happy, like, oh my goodness, like this is one of the best treatments I had.
It was worth it, the 3 days
It
of
was
swelling
worth
and
it,
panic.
yes. Yeah, exactly.
Yeah, I experienced that quite a lot also, that
Mhm.
patients panic and they start to call me on the next day
Uh-huh.
of the swelling and of the problems that they think it's a problem. I always say that anything in aesthetics is having a
Mhm.
solution.
And that's what makes a good practitioner. A good injector knows how to deal with complications
Yes, and to stay calm,
and to stay
because
calm and reassure your patients.
yes, yeah, that's true. I'm sure you manage this patient very well, and
Very
I'm
well.
sure any other who will come in the future, because we know they are there, the over panicking and over worrying patients.
Yes, yes. Don't worry. I think she was pretty happy with the treatment, and we still play pickleball, so we're still good friends.
You're still friends. Would you say that there might be some patients who take a little bit longer for a recovery, like swelling, in terms of anti-inflammation? If we just inject it, if someone has a bruise, that they might take a
yes.
little bit longer because of
Yes.
their health?
Mm-hmm. That's why it's also important that when you administer any treatment or procedure, you gotta know the patient's health history. You gotta check if they're using like anticoagulants, or if they're on aspirin, or if they have diabetes, hypertension. That because that can also affect the healing part.
Yeah, absolutely. I had one of those cases where I was actually a little bit suspicious if polynucleotides could work on her skin.
Yeah.
It was in the under eye area, and I would have suggested something more aggressive to approach these problems and find wrinkles, dehydration, and a lot of laxity
Yeah.
in a good way. But obviously she didn't want to go down this road because there are a lot of patients who don't want to undergo surgery or the long recovery time
Right.
after CO2 laser. So that was all we had in our portfolio. And there was quite a lot of bruising because of the fragile veins. Also in
Right.
this area, we know that's a lot of vascularization there. So I was a little bit worried about the recovery, but finally the guidance of the patient made everything go very smooth because she knew that she has to go through some days of swelling and of bruising, and afterwards the results will be worth it.
Yeah.
And even I was doubting because it was one of my first cases, and she was quite advanced in the aging process in this under eye region. I was very surprised about the results, and it's one of the cases that I showed in my presentation. Also, she was very happy, and that for a long time, which is also one of the benefits that I can see in polynucleotides, even the ones that can't afford or don't want to have very sequent treatments like every month or every 2 or 3 months. They have a good result even after one treatment, and they have it for a long time. It's lasting.
Yeah, I'm glad you were able to get through that patient.
Yeah, she was easy. There might be younger patients who overreact even more and call me next day and say like, I destroyed their face. They can't go to the dinner that they have planned.
Yeah, that's why it's also important that you ask them, like, are you doing anything in the next 2 days? That's why for me it's important, for the post treatment advice, so they know what to expect in the next few days.
Which is sometimes difficult because it's very individual, right?
Yeah.
Yeah. You usually say like fillers take some days to swell down, and in someone it might be more than a week.
But there's also this, but you also have to keep in mind that every patient reacts differently.
Yeah, it's still medicine, right? It's a human being. It's that we treat.
Yeah, that's the art of what we do.
Absolutely. Moving on to the next section where we will talk a little bit about the complication treatment. So did you use polynucleotides on any complication that you had in terms of inflammation in the skin after another procedure or after a trauma that patients experienced, like a wound?
Yes. Well, let me tell you. So I also discussed this in our symposium yesterday. So I had this acne scar on top of my nose, which I want to remove for the longest times. And I scratch it. I think it led to this nasty wound on top of my nose. For all places, it's in the middle of my face. And then good thing, I was able to get hold of the Crystal Healer PN, and I tried it on that wound, and I was pleasantly surprised. Like after a month, I can see that the wound is healing much faster than I expected, and I could continue using it. And after the second session, that wound is almost gone.
Nice.
Yeah.
And it probably wouldn't happen that way if you wouldn't have used polynucleotides on them, right?
Exactly. And I also noticed that the surrounding skin is less oily, and the pores also decrease in size. And that's the moment I said, okay, I think I'm going to trust this product.
That's a good learning. So now you can use it on oily noses and big pores.
Yes, and also that nasty wound on my nose, which
also nasty wounds.
I don't, which you can hardly see now.
I can't see it at all.
Good. I think it's done some good work.
It definitely did. It did indeed. I think the wound healing benefits of polynucleotides are really amazing. And I always tell my patients that if they want to get a treatment done like for maintenance or for anti-aging, they will see good results. But obviously when you have like a real issue and you add polynucleotides and they improve the wound healing, they accelerate all of this process of the scarring, which is preventing from fibrosis or hypertrophic scarring. There is where the magic is happening.
Yes, and I was also amazed at the case you presented about that post-surgical wound, and it only took 5 days, right?
Yes.
Wow.
Everyone was surprised about this, including me when I saw my patient. It was quite amazing. Yeah. So the early stage post-operative care using polynucleotides is one of the indications that I absolutely love, because you can see the benefits right away. This is something that for my surgical mindset is something very, very attractive and very interesting, because you can see how much they can benefit in these cases.
Oh, amazing.
Post-operative care is not easy. You always have to guide your patients through it because they know that they undergo surgery and it takes a while. But if you can accelerate this process, it is a huge benefit that I won't miss, right? It's very valuable to use polynucleotides.
Have you used it for hypertrophic scars or keloid scars?
Yes, I have done that. Thanks God that I didn't have so many cases that I needed to apply them on, but I had a specific case that had a lower face and neck lift done already 2 years ago, and she frequently came back because the hypertrophic scarring recurred all the time. It's like we did everything from the 5 FU injections and steroid injections to silicone pouches, and like every month or every 2 months the hypertrophic scarring came back. So it was kind of hopeless case. Actually, I told her that time will heal everything, but especially in hypertrophic scars that are always inflamed, the sensation of the itching and of the pinching is very, very uncomfortable, that sometimes doesn't make them sleep, so it's more something that you're worried as a practitioner because you have a patient that you want to do good on with a facelift to make them more beautiful, and finally they have a sequence that is giving them health issues and pain. So it's something that you really want to fix immediately and the best way possible. So after a long time of treating this patient with any other protocolized treatments that you had to do in this case, I applied polynucleotides. I injected it intralesional, and only after 1 session the problem was resolved.
Really? So the scar went away?
The scar went away.
Nice.
The inflammation went away within 3 days. The bulging went down within a week, and she didn't come back for another necessity of a treatment. And now it has been 10 months.
Oh, nice.
So it's quite amazing. Yeah. It's really good when we have this sensation again of doing good to our patients and helping them with something health related.
Yes, even with those patients with those old acne scars, I've seen some before and after. And with 5 sessions, those with really like bad acne scars before, there's still hope. It can still clear up and give you that smoother skin.
There is, which is quite interesting because I was being taught always that a scar is a scar, and it will be there for always. They say that there's nothing that lasts in life, not even marriage, but a scar will do.
Right?
Yeah, they say this.
Well, good thing these polynucleotides are stimulating this fibroblasts, which produces collagen and elastin, which will decrease those scars.
Exactly. Now with regenerative medicine, it's a whole new idea on treating those kind of problems, which is amazing. So I would love to move on to the next topic, which is a very particular one because I know that practitioners see this very divided. Mixed protocols. What would you say, Dr. Walter? Would you rather mix your treatments like polynucleotides in the same treatment with another one, or would you prefer to add them separately to your patients?
Well, I would like to give the patients those options because giving the polynucleotides by itself is already effective, but for example, I also like mixing exosomes with polynucleotides because it makes the healing make it faster. Instead of 2 to 3 days, it will only like 1 to 2 days for those bumps to disappear. And those patients love that. Like they can go out the next day and go to a party and have their face all cleared up. And also I also like if the patients are asking for more rejuvenative and tightening treatments, I do put in like a little micro Botox just for the tightening effect. And so it depends on the patients. So if they just want the polynucleotides, they can have it. But if they want to do like a combination, I will also give them that option. But I think combination treatments also work pretty well.
I think this is a trend right now that physicians, practitioners really like to mix protocols. I personally, I'm a little bit skeptical because I sometimes don't know how these things might interact and if it might reduce the therapeutic effect of one or another one. Though the clinical experience of all of my colleagues all over the world are confirming these kind of effects, like you just mentioned, that exosomes can really speed up the healing after injecting polynucleotides, or doing it multi-layered sometimes, because I think it's very reasonable that we treat, for example, toxins in a layer that is much deeper.
Yeah.
We act in the muscle, so it's not a problem to do in this simultaneous session another treatment that is targeting more the dermis or epidermis, either with microneedling or with injections.
Yeah, I think it's also safe if you do give them in different layers or in different places. I think that's pretty fine.
Yeah, I also think so. There are some things I would rather not mix with. Would you have any ingredient that you would say you would like to be more careful and treat first polynucleotides and then the other treatment, or the other way around, like devices, for example?
Yeah, I think we've mentioned about the devices. So with the energy-based devices, I think we can do it both ways, right? Giving it before the treatment, before they have their laser, or after the treatment is done,
Yeah.
like for post recovery.
Yeah, that's true. I would not do it right before the energy device treatment, because maybe the polynucleotides are not stable enough. I have read at least that they are water soluble, that they are very sensitive towards pH changes, so they are like naturally comfortable in the pH of the skin. But if you raise or if you lower the pH, which might happening with vitamin C, I have read about this, which is quite interesting, because there might be some substances like mesotherapeuticals that you want to mix it with, but if you have vitamin C and the pH gets more acid, that might harm the polynucleotides. Same as we've seen in exosomes, actually. They are very, very fragile.
Yeah. So with the energy-based device, how would you space them out?
I would really like to have first, if I do the pre-treatment with polynucleotides to prepare the skin, so I would love to do it at least 2 weeks before, so that I can assure that the regenerative benefits of the polynucleotides already worked, and then to do the energy-based device, and then polynucleotides right after or simultaneously. I would like to make the skin calm down before. Like if you use an energy device treatment that applies heat, I think heat is also one of those characteristics and biological things that might harm the viability of the polynucleotides, same as we have seen in exosomes. So to wait until the skin is not so hot anymore and then apply it for better recovery.
Like 2 weeks will be a good waiting time?
2 weeks before, and then right after, when the skin cooled down a bit.
Okay.
Yeah, I think so. I mean, as far as I know, we have some background about the biomechanical characteristics about polynucleotides or exosomes, but sometimes we don't really know the destiny when we inject them. We don't really know what is happening there. So we just can do what is within our possibilities, and always with the aim of not harming the patient. Would you agree?
Yeah, I agree. And then how often would you give, how often do your patients do the treatments?
That's a very interesting question, which is hard to answer, because every patient also has to have a personalized approach, something what I really love to do. And you always have to fit the treatment protocols towards their conditions and towards their expectations also. So of course, I always tell them it would be wonderful if you can get polynucleotides done every 2 or 3 months, but not everyone is capable of doing that.
Yeah, of course, with a budget.
With a budget, it's the thing. Exactly. The good thing is, as you said, they do one treatment and they can see results. And in my experience, they have the results for a long-lasting time. So even if they decide to do it twice a year for maintenance, it would be good. Of course, if we have like a real skin problem, in terms of aging, inflammation, or pigmentation, I would rather do a treatment series of 3, probably spaced out of 1 month, and then see how long it takes until they age back, because it's not on us. It depends on lifestyle, on their dieting, on their mental health, on their sleep, on their internal healing capacity, on their age also, right? So maybe if we have this reset of regeneration with polynucleotides, it takes for someone longer or shorter to get back to the initial age state.
Okay. Well, with me, so I advise my patients for the initial session, you do like 2 sessions 1 month apart, so you can just build on that collagen building phase, which takes usually like 3 weeks to like 3 months, right? And then they can do maintenance sessions every 3 to 4 months, or at least 2 or 3 times a year, and that makes it easier for them to remember.
Yeah, I think that's a great approach. And I think you got something very basically right, which sometimes is a little bit misunderstood in aesthetics when they give you treatment protocols, especially from companies, that you're asking yourself, but based on what? No, if you have to get treatments every 10 days or 14 days done, you don't really understand what's the reason behind if it's not a commercial one, because the skin needs time to have this
I agree.
healing, no?
Especially if you do like a lot of pokes, like if you do like 100 injections, definitely you give your skin some time to heal.
Exactly.
And usually that takes at least 28 days or a month, right?
Yes, yeah. I really like that too. It's also not easy for patients to have the downtime and recover from some slight bruising, even if in polynucleotides it's very quick. You agree? You have seen very fast recovery of days, right? Not
but you know, I mean, in general, I just like to keep it like a month apart.
Me too.
Yeah, it's the minimum for me.
Yeah, me too.
Just enough time for your skin to recover.
Absolutely, and to make effects also.
Exactly.
Yeah, I really like your approach, and I like that we are on the same page. Okay, Dr. Walter, I would love to ask you some very tricky questions. Are you ready for those?
Bring it on.
Let's go. Polynucleotides, face or neck?
Face.
Your desert island aesthetic treatment?
This is a hard one, but let's go with polynucleotides. It's very versatile.
Amazing. Regenerative booster, microneedling or injection?
I'm pretty old-fashioned. I would go with injection.
One trend you would wish disappear completely?
I'm not really a fan of HA filler for the under eye because it produces some lumps, especially if it's placed in the wrong plane or if you're using the wrong product.
Great answer, and I agree. Crystal Healer PN or PN Plus?
I like both, but I will go with PN Plus because you can use the cannula and also intradermal for PN Plus.
Great. Thank you for your answers.
But you know what? With the polynucleotides, if the patient has the budget, you can practically do it anywhere on the face, on the neck, on the hands, on the knees, right?
On the feet.
On the feet. If they want some regeneration for their feet, why not?
Did you ever have a patient asking for that?
No, but I think most of them ask it for the neck because at least you get value for what you pay for, right? It shows on your face. And my next top spot will be on the neck.
Would you try it on your feet?
On the feet? Yeah, if I have an extra product, why not?
Let's go. Let's make a patient trial.
But some clients, well, a few of them have them done on their hands, because the hands also, are one of the secret spots that show signs of aging.
Absolutely, it's a little bit forgotten area, but very necessary to treat because if everything's perfect, and then they show the hands.
Yeah.
Especially in Europe, we see a lot of patients with age spots and dark spots because of the sun and the lack of protection with sun.
That's true.
Cream.
Well, but if you're going to spend it on your face.
That's right.
All right. I think it's my turn. Are you ready?
I'm ready.
Okay. Favorite area to treat?
Under eyes.
Okay, good one. Okay. Biggest misconception patients have?
That something non-invasive can make them look like 20.
Okay. All right. Under eye treatment, fillers or PN?
I agree with you, Dr. Walter. PN.
Yes, I agree too. Crystal Healer PN or PN Plus?
I love both, but I would go for Crystal Healer PN to have the pure polynucleotides for wound healing and anti-inflammation.
Yes, and it does have 2.5%, which is higher than most brands in the market.
The highest that you can find in the market right now. Yeah, that's right.
And you have so much in one syringe. It's 2.5 cc, so it's enough to treat the entire face. And I think you still have some left to treat your neck as well.
Absolutely.
Have you used polynucleotides for the scalp?
Yes, absolutely.
Yeah?
It gives very nice results. Especially here, you can perfectly combine polynucleotides with other treatments that can add on some other benefits, like with peptide therapy or with hormones or even with vitamins and minerals that the scalp needs for like having in general a better scalp health for better hair growth. So I love combination treatments in hair.
Nice. All right, maybe I should start trying on those too.
On yourself first.
Is that-
You don't need it.
How's my hair? Does
I
it
think
still
you
look
don't
good?
need it.
Okay.
Dr.
Mhm.
Walter, I have some more tricky
Wow.
and provocative
Some
questions
more
for
questions? All
Of
right,
course.
bring it on.
you. What is the biggest lie that patients tell you?
Their age. How about you?
That they put sunscreen and they didn't.
Oh, really?
Yeah, definitely. Great. I have another question for you.
Okay.
Any kind of treatments that patients are addicted to and it's super trendy, but it barely works.
I also don't like those derm rollers, those little brushes with those little tiny
Yes.
needles that you do it yourself at home.
That looks scary.
Yeah, and you don't replace those brushes or those derm rollers. I think it's just prone to infection
Yes,
and
prone to
contamination.
infection. Patients, if they use it at home, they don't have the possibility to sterilize it even.
Yes.
So
And then you just put on your blood and roll it with a derm roller.
they can create scars with
Yes.
this and inflammation.
Yes.
Yeah, it's quite
I've
scary.
seen horror stories.
It's horror what you can see sometimes on social media, what patients do to themselves at home. Well, I have seen some cases of non-invasive skin tightening procedures. I don't
Mhm.
want to name
Really?
specifically which
like
ones.
what kind?
The ones where you enter with some devices inside the skin and
Like
you
with the
apply
fine wires or
exactly some of those, for
Oh.
example, or even where you apply a lot of needles in combination with energy. Radio frequency microneedling can be very useful,
Mhm.
but I think it's absolutely in the hands of the practitioner to use this right or wrong, and to make it very efficient sometimes can be very harmful. So I've seen patients recovering from this same time as a
Yeah.
surgery takes.
and it also melts a lot of your facial fat, and it can also there's also potential for some nerve damage
True.
if done incorrectly.
True, absolutely true. So
Mhm.
those are the treatments that can be very beneficial. I don't want to speak badly about them, but you have to be very careful. Is there any treatment that you secretly dislike? I think you mentioned already something
Yeah.
about the under eye
The
fillers.
under eye fillers, the ones with HA, because sometimes it gets lumpy if not done correctly, or if placed in the wrong plane, or if you're not using the right product.
Or too
Sometimes I have
much.
to. There's like some patients who go to me, which with under eye fillers done by other injectors, and I just have to melt them, and I just have to replace it with something else that's more natural and
Yeah.
doesn't end up looking puffy.
Amazing.
Yeah.
So you would suggest
Yeah,
Crystal Healer
so
PN Plus?
I'm glad there's already polynucleotides, Crystal Healer PN Plus. This one, I do it via cannula under the eye, and I've seen pretty great results with my patients.
Amazing. After
Yeah.
I've seen your
Yeah.
results,
Yes,
actually,
I
I
think
want
you
to
saw the
start
pictures from yesterday,
to get
right?
going with this
Yes.
myself. Yeah.
And that's the nice thing about this product, because it's enough. You only need like 0.5 mLs per eye, and that will already provide a nice lift and a nice um a nice a nice layer to your under eye area.
Nice.
And
Thank
you
you
still
for
have
sharing.
enough for the feet.
Another tricky question.
Yes.
Which is a patient's request that drives you crazy?
Which treatment request? Do you have some?
When they ask me after 3 months for their toxin retouch,
Oh yeah, yeah. Some
And you're
people
like,
can get addicted to
you
it.
really pass the time for the retouch. You usually do it after
Mhm.
2 weeks, and they think it's for free still after
that
3
brings
months.
out a lot of resistance.
Yeah.
Yeah, that's why I try to tell my patients, you try to space your toxin treatments at least every 4 or 5 months,
Yeah.
so you don't develop this kind of resistance.
True. Dr. Walter, what do you
Yes.
think how doctors will treat aesthetics in the next 30 years?
Wow, that's a great question. You know what? With AI, I think everything might change in the next 20 or 30 years. Imagine right now we have these products, the polynucleotides. So they might come up with something else that's way more advanced, and that would probably be life changing. So I don't know. I cannot imagine what what will be in 30 years.
It's hard to imagine.
Yeah, but I hope it will be something great, something nice, and something that will help everyone.
I also hope so. I wish for a more personalized and targeted medicine in aesthetics. Sometimes you doubt a little bit about this when you see that everything is AI created and less specific maybe, and people following like protocols. But I think AI can be a great tool also for diagnostics.
Yes.
Like to see how much you have to inject where and what exact constitution of the product is necessary for that skin. So I think in mesotherapy, it could be very interesting to really know how much of vitamin D or vitamin C they have to use for specifically your skin.
Right. And also, as you know, some doctors and some specialties are already losing their jobs to AI. Hopefully, aesthetic medicine will still be here in the next 10 years.
Hopefully.
I mean, would you trust a robot to do your to do the injections for you?
I actually wouldn't. And I think in medicine, a lot of specialties will not be wiped out by AI because I hope to believe so, that we will trust a person more than a machine.
But I'm pretty excited for the innovation and the technology that will be out there in the next 20 or 30 years.
Me too. Innovation is great, but always with evidence and always with care to not do harm to the patient, but do good.
And probably they can invent something that you just have something to inject, and then you will just stay young forever.
What would you inject?
I don't know. Hopefully it's not the substance, or you might end up like Demi Moore.
Maybe salmon sperm injected in the body, like intravenous. Who knows?
Who knows?
Who knows? I think there will be a great development also in everything towards integrative medicine, supplementation, hormone replacement therapy. I believe that there is a big change in the mentality of people taking care of their inner well-being. So I have a lot of hope that this will change and there will be more accessible and more unified protocols on how we can help patients on that level.
Yes, I agree. And I'm truly excited for that to happen.
Before you enter in andropause.
Which will be like in 50 years.
Because you're 20.
Oh, wow. Oh, this was such a great discussion, Dr.
It was.
Sophie. I enjoyed it so much.
Thank you so much, Dr. Walter, for all the insightful and very honest discussions that we had today. I think it's amazing that we can talk from colleague to colleague and just share our experience and knowledge. There's a lot of misception and a lot of false marketing claims out there. So I think we as practitioners and also all of our patients out there deserve the truth about aesthetic medicine. And I hope we could contribute a little bit to a better and more innovative and more truthful medicine.
Yes. And as injectors, I think it's very important that we only give the right treatment and the right product to our patients. And we have to do our research. We have to do our testing. And then we also have to just make sure that we have the patient's priority on our hands as always. Because we just want them to give the best treatment and the best product. And that will ensure our career in aesthetic medicine.
Yeah, thank you for that. If you know to use a product in your mother, you would also use it in your patients, right?
That's true. And I think my mom already enjoys the Koru products.
Thank you very much to all of our listeners to tune in to the Koru Aesthetic Dialogue. I think this will be one of many sessions of a very nice podcast that we will have between very different practitioners from all over the world sharing their experience and their knowledge on the wonderful products of Koru Pharma and aesthetic medicine in general.
Yes. And don't forget to hit like and subscribe. If you enjoyed this episode, don't forget to join Koru Academy and follow Koru Pharma on Instagram. Until next time, stay curious, stay inspired, and take care of your skin.